now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast. Today we will talk about cancer. And I'm curious if you knew that the second leading cause of death in the United States is cancer. And, it's pretty deep when you think about it. Literally, 1 out of 2 men in the United States are likely to develop cancer in their lifetime, and 1 out of 5 are likely to die based on the data from the American Cancer Association. And for women, it's not much better because 1 out of 3 will likely develop cancer and 1 out of 6 will likely die from it. So, if we are to truly protect our nest, it's important that we have an understanding of what we can do to protect ourselves from the second leading cause of death, which is cancer. And although there are many ways to, think of how to do this, I really wanted to make sure that we were fully aware, all of us, of the many ways to protect ourselves from cancer. And one of those ways is to achieve metabolic health using a ketogenic dietary pattern. That's why today I will introduce you to a guest who has literally shifted her focus from her previous profession as a radiation oncologist to a clinician who is now focused on helping her patients achieve metabolic health. Today's guest is Christy Kesslering. Dr. Kesslering is a board-certified radiation oncologist. She achieved her Bachelor of Science degree from UCLA and attended medical school at Loyola University, Chicago-Stritch School of Medicine. She finished her Radiation Oncology Residency at the University of Wisconsin-Madison in 2000 and has treated cancer patients in the Chicagoland area, which I'm so excited about because that's where I'm at for the time since. She's realized that, many years of, doing her conventional medicine wasn't exactly what was, hitting her in the right space in her heart. So she got some additional training like I did. I also got functional medicine training like she did, and she took it even further and got some integrative medicine training and terrain theory cancer trainee. So she's now a Terrain Certified Practitioner and is a founding member of the Society of Metabolic Health Practitioners. She now works remotely with cancer and non-cancer patients alike to improve quality of life, reverse chronic diseases, and optimize health outcomes. I am totally excited because when I saw her having a conversation with our, esteemed leader, Dr. Eric Westman, on his channel, I knew I wanted to have her on the podcast as well. So with that, Doc, I welcome you to the Protecting Your Nest podcast.
Thank you. It's great to be here. I love spreading the word.
Yes, and I when we had a little chat before the recording, you mentioned you were not far away from where I live. I literally could probably drive 15 minutes and be in front at your doorstep. So it's really cool that we're so close, and it's really a big deal. And I know we both belong to the Society of Metabolic Health Practitioners, and if anybody goes to that website, which is a great place to look for clinicians like us, you'll find not a lot of people light up in Chicago, which is shocking. We have 3 million people in the city itself and probably another, 2 or 3 that's outside the city. And yet we have a handful of clinicians who focus on metabolic health. And I hope that number continues to grow. And that's why I was so excited to finally learn of you. I do want to announce that there is a metabolic nutrition for cancer course that we're going to share in a link. And I think if you are enjoying this episode of the podcast, you're probably going to enjoy learning more. And we're just going to touch it. We're going to scrape the surface, but I'm sure the course will go a lot deeper. So thank you for being involved in that as well. So let's get started. Let's get our audience familiar with you and talk a little bit about your background, your family, and maybe even the things you like to do for fun.
Okay, that sounds great. Well, you already gave the background on my education.
That's right.
I happened to meet my husband when I was in medical school, although he was not a physician, and he shares my second love, which is swimming. So he was
Nice.
actually a swim coach at the area high school and club teams. So he journeyed along with me up to Madison, where he worked there while I went through school. But we had our first child when I was in internship. We had our second child while I was in residency. And
Cool.
then we moved back to Chicago and we had two more. Um, Interestingly, we did have a little space between kid number two and kid number three. And in retrospect, guess what? I was suffering from some metabolic health disorders that I
Mm.
didn't realize. And I came across low carb keto, and I thought, well, I've had two kids. I've got some extra weight. My family my genetics are putting on a little extra weight. So I decided to do it from a weight loss perspective, but
Hmm.
did read a lot of the studies and started to understand some of the actual health benefits. And lo and behold, pregnant with three and pregnant with four. And if you are aware of metabolic health information, right, metabolism plays into fertility. So it
That's
was
right.
quite, you know, wonderful. But I didn't realize that that was the reason until much later in life when I started reading deeper into the literature. But so therefore, I am a busy mom of four. I have two already out of the nest, working real careers, one in Japan, one in Chicago. And then I have two still in college. So finally into the empty nester stage, and enjoying life. I still love exercise, and I know that's part of the nest.
That's right.
And so that's always played a large role in my life, and learning more about various types of exercise and what really maybe enhances metabolic health the most. And so have done lots of different schedules, used to do more competing, even doing some triathlons, realized that maybe I was extending myself a little too much with a busy mom of four and a big, practice, and kind of reining things in and trying to optimize my own terrain.
Yeah, love it all. One of the people who's a good friend you remind me of just because of the that kind of gynae discussion is Dr. Salcedo, who is she has a YouTube channel called The Conscious Gynecologist, and what I love about her channel, which is more focused on women's health, is it lets you know, yeah, we kind of think about polycystic ovarian syndrome, but we don't think about how fibroids is a metabolic disease, and then uterine cancer is a metabolic disease. And I think it's important to have those aha moments. And like most doctors, you said, didn't really look deep into the research at first. And truth be told, doctors are so busy, they're not really looking deep into the research. So a lot of times they're just following guidelines and things that they assume represents the same values they have, the same perspective they have, that same due diligence. And the reality is, a lot of the studies that have driven our decisions have not been of that quality. So, and even when I heard you discuss the conversation you had with Dr. Eric Westman, he was kind of nuanced and asking questions about types of studies and things of that. So if it's not of high quality, we really need to pause. And if it's not of high quality and that's all we have, that's okay. But we need to say that out loud. And
Yeah.
just like carnivore, I tend to be a carnivore. And the reality is we have not a lot of studies about carnivore. So we have to say that out loud. We can then explain why we still prefer that dietary pattern. So I'm really happy that you're honest enough to say, man, I didn't dive deep in the beginning, but when I dove deep, good things occurred. And one of the things that occurred is that you've been to school for a long time. You've been working with patients and doing your work for a long time. So how dare you transition from radiation oncology to metabolic health? I could imagine how that was perceived by the family. So I do want to hear a little bit about you transitioning, what made you do that, and speak a little bit about that.
Sure. Well, so as you know, and as we know, so we didn't understand cancer from the true metabolism standpoint, but we certainly knew that diet and lifestyle played a role. We knew that obesity played a role. We already knew, okay, let's stop smoking, let's not excess drink, let's get out and move. But obesity, which is such a problem in our country and even in our world, it
Mhm.
is, just growing by leaps and bounds. But all of these cancers, seem to be associated with
Mhm.
obesity and more as we went along. And I had a very heavy female clientele. I did a lot of the breast cancer and endometrial cancer, which
Mhm.
tend to be very hormonally obesity driven. But yet we had skinny breast cancer patients and skinny, endometrial and ovarian patients, et cetera. So I originally started getting into kind of the metabolic health with just more diet coaching and
Mhm.
can we help you reduce your weight? Because if weight is related and heavier people do, like, can we just help you there? But then again, as I dove deeper into the literature and got exposed along the way, I changed, over the course of 15 years, going from it's about weight to it's about insulin and insulin signaling and glucose metabolism. And so as I learned more, I started supporting patients in that role. Even though there are mouse studies and we're not mice, there are a growing body of literature in
Mhm.
the human population. We maybe aren't looking at survival as much as we're looking at recurrence risks or improving outcomes, imaging outcomes, pathologic outcomes, etc. But I just saw this need. And so probably 7+ years ago, I started a monthly support group, had a big following where every month we would talk about a topic. We'd talk about every single new study that
Mhm.
happened to come out that month and relate it to other things. So I might pull data or studies from another, from diabetes literature,
Mhm.
from obesity literature, but how does this tie in to cancer? And yeah, it was a big jump once I said, okay, I think conventional medicine is no longer supporting the desires that I have because it was so limited in what I could do. And how many patients were actually receptive to the conversation.
Mhm. Yeah.
And we can get into that next. But once I knew that this was my passion, I knew that I was going to be doing this at some point,
Mhm.
and then the whole COVID stuff happened, and I'm like, this is a good time to
That's
make
right.
that shift. And so I did, and I have an extremely supportive family. I had a very supportive, um, group that I came from, and they still support my decision, and we're still all friends, and I
That's
still
right.
get referrals from that group. So it is. It's been a nice transition, and I will say definitely different, but I don't, I don't doubt my decision.
That you say different, so I just wanna pause for a moment. I know for me, although I'm still in a conventional model, and I integrate, shout out to the functional medicine people, but so I'm doing a little bit of what you did with your integrate. I integrate my metabolic approach into my practice, and it's really at the forefront, and then I use conventional when I have to. But I feel like a healer. So, other parts of this that have benefited you, I know you benefit your patients, and I'm thankful that your colleagues don't look at you as a, unicorn. They probably
Well,
still
some
do.
of them do.
Yeah, that's right. They probably do. Yeah, so that's another subject. But what does it feel like to practice this way? Like, when you wake up every day, what's different about your experience as a doctor now?
Oh, well, the beauty of just being able to walk 20 steps to my office, no, that is not, certainly it does give you a little bit more work-life balance, I believe, which is definitely beneficial for my own personal metabolic health.
Yes.
Um, but what I find so rewarding is that now 100% of my patients are here because they want help with
Mm.
their metabolism, with their hormone balance, with their cancer outcomes. Whereas when I was in the conventional model, and I'm sure you have patients like this too, don't you have a pill for that? Don't you have a
Mhm.
treatment for that? it was never about, uh, finding the root cause, because I say cancer is just your check engine light going on. A healthy
Mhm.
body doesn't get cancer. So what was going on? What is going on that we can help you heal so that you will absolutely crush this, right? And we can use conventional therapy. There's so much data, and when I say so much in my world, it seems like so much data, that the combination of metabolic, health, so using diet and lifestyle techniques to optimize metabolism in conjunction with conventional therapies looks so rock solid. Yet I would
Mhm.
have the patients in conventional world having this conversation, and some of them are like, I am right there with you. This is wonderful. I'm so happy you're a part of my team. But then other team members are still following conventional wisdom. Oh, you shouldn't do that way of eating. You should do this way of eating. You shouldn't lose any weight during treatment, even though they're losing inflammatory fat,
Mhm.
obesity weight, not lean mass weight, because there's data that we retain lean mass. So
Mhm.
anyway, it was a bit of a struggle there, where I was impacting people, but not to the degree that I wanted. So now in today's world, telehealth 101, I get to impact, I feel like, every patient I touch.
Okay, I love that, and, it's funny you say that because my team, they joke about me, and when patients see me, they'll say, "Oh, so you saw somebody today with a ankle sprain. You probably said that you can fix that with keto."
Yes.
And I'm like, "Actually, I did say that because I want them to heal properly." So they
Yes.
kinda they joke with me that that's my answer, my hammer for everything,
Yeah,
but
yeah,
the
yeah.
reality is, in some ways, it's true, since so many of the medical conditions that we deal with are metabolic. Now, when we think about, and we'll talk a little bit more about insulin in a moment, but when we think about, like, okay, people who have weight issues, they probably are likely people who eat a lot of carbs. People who uh, eat that way tend to make a lot of insulin, and we know insulin makes things grow. That doesn't sound like a good idea for cancer. Diabetes is a very inflammatory condition. Oh, we're still talking about carbs and glucose, right? So it kind of makes sense that a person who has a not so ideal body weight may be at higher risk. Makes sense from a diabetes perspective. But then you have a person in front of you who hears a lot of things out there in the world about diets, and a lot of times, I know we did a video short talking about, what dietary pattern is one to consider for cancer. So you have somebody in front of you, and then you say, "Hey, are you willing to consider keto for cancer?" So my question is, when you're faced with that conversation, are people receptive, and are they finding it fairly easy to transition to that dietary pattern?
So I'll go back and use my experience in the conventional world, where I had lots of different mentalities coming
Hmm.
at me. Again, as opposed to my current practice, where so many of them are already coming to me because they want help with a ketogenic or a carnivore style diet. But in
Good point.
conventional practice, yeah, I would discuss this. They got it, like it clicked. Okay, sugar, insulin. And many of them would embrace it during their course of radiation. I was seeing them every week for a
Hmm.
period of, a month or 2 months. And so there was a lot of support, and we would check insulins before they started. And we'd say, listen, this is where you are. Here's some of the data. And we know that when we use this way of eating, we can reduce insulin. Now, some were a little more hesitant. I think that if somebody wanted to incorporate more plants, we would talk about how could you do that and still maybe lower
Hmm.
insulin, because there is data on other diets
That's right.
working. Because if if we're taking out the worst carbohydrates, right, the processed
That's
carbohydrates,
right.
the sugars, maybe some of the starches, but allowing a little bit more flexibility as far
Mhm.
as fiber rich carbs and such. So I did have some people who were even vegetarians that were
That's
following
right.
very low carbohydrate, kind of keto esque but probably not to the degree that I wanted it, but they were reversing some of their symptoms. And I even had, I can't remember, but an elderly patient, 80 something,
Mhm.
and this is a new trick, right? She's like, I don't know. And she goes, oh my gosh, it's the first time I've been able to walk by the junk food that
Mm.
my husband buys and I don't want it. So I saw some really wonderful
Mm.
successes, and
Mm-mm.
many are still giving me words through my colleagues that they're still holding strong and still, staying with ketogenic style
Mhm.
eating. So it's fun when you see and hear the success stories. And even more importantly, it's the trickle down effect, right?
Mm.
Sometimes it wasn't the patient who changed her way of eating, it was all of her children.
Mm.
And so maybe we just saved a generation of cancer
Right.
patients.
Wow. That's powerful, and I've seen the same thing. I particularly, um how many times do I have to remind people, get a fasting insulin if you can? It's really, I did a video about hypertension on YouTube, and I showed the graph of the things that predict heart disease, and the cholesterol and the LDL, the total LDL were baseline. And the blood pressure was 1.9 times more predictive of a heart attack, but the fasting insulin was 6.7 times more predictive. So it's not just about cancer, even though that's the topic for today's podcast, about heart disease and stroke and dementia. And if you can keep your insulin level in a reasonable range, it could be a game changer for those generations to come. So I really love that butterfly effect of reaching more people. I think that's wonderful. I do want to touch a little bit about the benefits. I call myself the metabolic health doc for a reason, and that's because I think most chronic diseases, or so-called chronic diseases, are related to poor metabolic health. So, just from your perspective, the benefits of focusing on metabolic health to reduce cancer. I know we've touched on that, but I just want to broaden it up just from a metabolic health perspective.
So for reducing the risk of cancer, I think that there is most of that information is observational, right? So
Yes.
we're looking at populations, who gets cancer, who doesn't. If we just look at fasting glucose levels, we can see that being related, but we know that even at normal range glucose, insulin has already been elevated in a dramatic number of people. Probably,
Hmm.
what Dr. Kraft back in 1975 said, what, 70 to 75% of patients who were non-diabetic,
Hmm.
non-pre-diabetic, actually had hyperinsulinemic responses to a
That's right.
glucose load.
That's right.
So there's definitely data that says, with higher levels of insulin and higher levels of IGF-1 and insulin-like growth factor, that we do have higher rates of cancers. I don't know that we have the magic number. When
Hmm.
we look at breast cancer literature, very low. This was a study actually out of Canada, and it was fasting insulins of less than 3.8 in American, units. Those patients had the lowest rates of recurrence and best overall survival from their breast cancers compared, to, I think the highest group was just over 7.5, which is still lower than the average American. And that was, I want to say it was maybe a 4 times risk of recurrence and an 8 times risk of mortality.
Hmm.
Again, that was in earlier stage breast cancer patients, so relatively smaller numbers. But when you are talking about 2 and 4 and 8 times something, that's causative. That is,
Yeah,
right? That's a real thing.
that's a real thing. And I think our knowledge is continuing to evolve. But for me, um, some of it is kind of like common sense. So um, I know that when I think about the carbs and the extra glucose floating around, reminding people that we only have 1 teaspoon of glucose floating around in our blood at a given time when things are normal, and our body doesn't like all that extra glucose. But so we have to make insulin to put it in its proper place, rather it's storing it as fat or, finding some, glycogen in our muscle and in our liver, et cetera. But man, it's like we don't want that insulin like growth factor to be high, in the liver, making our cells want to grow and proliferate. We don't want overexpression of our GLUT1 and our GLUT3 receptors that may be overexpressed in cancer. And if we have receptors that like or that are there for glucose and then we overexpress it, then we don't want to feed that with more and more glucose in our
Yeah.
diet. So it's just, to me, it's just like common sense. Again, we're going to continue to see the research, et cetera, but it sounds like there's enough out there now. And anecdotally, I think in your practice, you're seeing the results. I certainly see a lot of good things happen when people make these dietary changes. So one of the things I wanted to ask you about also is our genetics. I think a lot of people have people in their family who are dealing with cancer, have a family history of cancer, and a lot of them kind of feel that they're destined. It's just a matter of time before they get it. So they do their screening tests, but wouldn't it be nice if there was something else they could do? So talk a little bit about our genes and whether or not we're doomed, we're destined for.
Yeah, well, as we know, there are some very specific cancer-related genes like BRCA1 and BRCA2. But if they truly were your destiny, then every single patient who had one of those genes would get cancer, which is
Mm,
certainly not the case. And so we have to ask ourselves, well, what are the people doing that didn't get the
mm-hmm,
cancer, right?
mm-hmm, right.
Maybe they have decided not to live the same lifestyle and eat the same types of foods that their siblings or their parents did or are, and they are protecting themselves from those changes. But what has really kind of come to light is that cancer really isn't a genetic disease. It's actually a metabolic disease. It is
Mm-hmm,
a dysfunction of our mitochondria that then send out stress signals to our DNA and turn on tumor, oncogenes and turn off the
mm-hmm,
tumor suppressor genes. So it's kind of like the cell there's has reverted back to like every man for themselves mentality,
mm-hmm,
like that, like the mitochondria are healthy. We're all living in this wonderful society. I'll do my job, you do your job. I'll take up my space, you take up your space. And then they lose that signaling. They lose
mm-hmm,
that community and they become every man for themselves. And they just want to gobble up the resources and divide because that's how they will survive and we have to, I always say that cancer is a little bit like, a 2-year-old throwing a tantrum that something has
mm-hmm,
gone wrong. And we need to say, what is going wrong and how can we help you fix yourself?
mm-hmm,
And maybe it's not fixing that cell. Maybe it's helping the immune system, the surrounding inflammation, lowering the growth factors so that
mm,
our macrophages can go and take care of it. Maybe we can put that cell through its normal cell death, saying, sorry, you're too damaged to be part of our society. You're going to
mm,
have to go through the normal channels. And then again, we just need to help clean up that terrain and support
mm-hmm.
our healthy, normal immune function, our repair function. We have so much, we are made to heal. We just have to give ourselves the right tools.
Mm, and you sound like you're training, well stated, doctor, as a functional medicine doctor, and I think that's important. And one of the things that I want to echo based on what you said is, if you heal the body, it will heal itself. Like let's support our immune system. Let's support our gut. Let's our circulatory system, our nervous system. let's detox. Can we get rid of toxins? Is our body able to do that? So I think all of those things matter, and magically you heal. It's so magical, and even if we were able to come up with the perfect genetically focused drug to target that cancer, that's great news until you genetically, mutate.
Right.
So by the time you got it from the lab to the patient, they may have changed, and all of a sudden it's not even targeting. So a better approach is just tell the body how to heal, and then maybe the body will be smart enough to figure this out as well. So I like that kind of heal the body approach. And it's almost like no matter what the outcome, you're going to do better than you would have done if you had not done this. So this is just the most logical approach to take, and I really appreciate like that kind of framing. I'm curious. I'm sure a lot of people who came to this podcast are curious about, what, I dealt with breast cancer. My mom's a breast cancer survivor, and I'm not sure if this is going to help me. My patient may come to me and say, hey, I'm dealing with this increased PSA. I just had a biopsy positive for prostate cancer. Is that good for me? So are there specific types of cancers historically, based on what we know so far, that benefit more from this dietary pattern from what you've seen in your experience? And I know it's still an evolving science.
Yeah, it definitely is evolving. So it's really, I mean, I think we have much more in those that are more common cancers, right? We've got a number of like breast and gynecologic, um, and metastatic. A lot of times
Hmm.
when we're end stage, we try some of these things because there's nothing quote unquote left for the patient, but yet we've seen some decent imaging responses. We seen it in colon, and so there are a number of tumor sites. But as Otto Warburg said, there really is only one primary cause of cancer, which is this metabolic
Hmm.
mitochondrial dysfunction. So I think everybody can benefit from that. I think everybody can benefit from improving their own immune cells and surveillance. And I think that every once in a while there's some negative press, because people misunderstand what it is. This is not just a high fat diet,
Hmm.
right? Because a high fat, high carb diet is terrible. Even if it's
Right.
low carb to conventional wisdom, it still is a high carb or a mixed diet. And that really is going to drive insulin. So unless you are looking at insulin, and is it coming down? Are you looking at the degree of ketosis? Is somebody even making ketones? Are they actually in a ketogenic state, or are
Hmm.
they just following what they think is a ketogenic diet? And I
Mm.
will tell you that I have seen a number of people increase their insulin following a quote unquote ketogenic diet because of chronic calorie restriction, which then jacks up cortisol, puts you in a fight or flight
Mm.
mode. And then all of a sudden your body is like, hey, a famine is coming. Let's store
Right.
away some fuel. And in order to do that, they have to raise insulin.
Mm.
So I think that if you're not testing, you're guessing. And
Hmm.
guessing isn't going to work. Now granted, if we take some of the basic principles, which is get rid of processed food and high sugar, yes, you're probably going to do better, but I don't there is some stage 4 data that unless you were really driving your insulin down, you didn't get the benefit. Even if you
Hmm.
lost weight, but it was about moving insulin down.
Mm.
So if these studies don't actually test metabolism before and after, I'm hard pressed to believe them.
That's fair. And sounds like Houston, we have an insulin problem. So many people who have come to us in the past over the years have said, I have a hormone problem. That's why I can't lose weight. But who knew that the hormone was insulin? And
Insulin.
that, yeah, it's just insulin. So I'm just happy that we're learning this. And another thing that's interesting about how we look at cancer, and this is really controversial for those who haven't looked at the science, and this is the idea of fasting. Uh, you know, I had a previous guest on the podcast who wrote a book about using fasting with chemo,
Hmm.
and that's like a contradictory thing to say, right? And I think it was Trenton Bourne's book, but anyway, her book was really fascinating because it talked about how when you're fasting, it may be beneficial for chemo. So I think it's important that we talk about fasting in general as it relates to cancer, and then maybe even how it may be helpful for chemo. So let's touch on those two topics as well.
So the original ketogenic diet was a fast because it stopped seizures, and they
Mm-hmm.
figured out that the reason it stopped seizures is because it produced ketones.
Yeah.
But they didn't think that it was the ketones was the benefit at the beginning. So there are a number of ways in which we might get a patient into a ketogenic or a fasting mimicking state, and that can be with severe calorie restriction. So one of the fasting mimicking diets that's out there in the data world is just a severe calorie restriction.
Mm-hmm.
During and around chemotherapy, there was a study with water fasting. Um, my bias is it just puts somebody in a ketogenic state. So some cancer patients, right? Not everybody is carrying extra weight. Even some people who are obese actually have sarcopenia, meaning they
Mm-hmm.
have already muscle wasting. They're protein malnourished. And so I actually don't always use true fasting. I like to look under the hood and say, does
Mm-hmm.
somebody's not metabolism, but nutrient status, are they sufficiently proteined up and micronutrient sufficient that they can withstand some fasting to get into a
Right.
deeper state of ketosis? If they're not, we might use other things to get them into a deeper state of ketosis, a very high fat ketogenic style diet.
Mm-hmm.
I will sometimes use a carnivore diet over a standard ketogenic diet because there was a ketogenic ratio paper that was published a number of years ago that kind of intimates that if you replace 1 gram of carbohydrate with 1 gram of protein, you actually get a better ketogenic ratio.
Mm-hmm.
So again, it's almost like 2 grams of carbs equals the other way, 1 gram of carbohydrate, you can eat 2 grams of protein. So I have had a number of patients when they kind of switch temporarily to a carnivore ketogenic diet, they're like, oh my God, my ketones are so much better if I just eat a carnivore ketogenic diet. So I'm not
Mm-hmm.
advocating that for everybody, but some
Mm-hmm.
patients do respond better to that. And we know, you and I know, that we get far more micronutrients, more bioavailable micronutrients when we use our animal-based foods to get that into us, as opposed to plant-related nutrients, which are not in the form that we actually need them, and maybe not in the right balance that we need them.
Absolutely. I think I really want to make sure people walk away with a little bit of a takeaway. And at the end of the day, if you're rather you're talking about keto dietary pattern or fasting, you create glucose scarcity when you do that. So glucose is not around, and I literally I hate to even say this, it just drives me crazy. So I had a patient yesterday who saw our one of our nutrition clinicians, and they were told as they were getting their diabetic education that you have to have carbs in your diet in order to you just can't live without carbs. And again, we're not saying no carbs. I'm more carnivore, but we're just saying low carb. But beyond that, it's just amazing. So the question is, if all animals need glucose, then what are the lions doing? How are they surviving? You know what I mean? So it's like, so I just want to
Yes.
say that. So we got to really get to this education, how we are teaching our professionals so that they can at least say that they may have a preferred approach, but to say that you have to have carbs. It's not even, it's just something that I really worry about. Now, having said that, so you have fasting or keto, you have scarcity of glucose. Your body knows it needs fuel, so it's going to now rely on ketones. So thankfully, our liver can produce ketones and fatty acids and things like that, which is great for our normal cells. But guess what? Our cancer cells are not in love with ketone.
No,
You know,
definitely not.
yeah, so that's why it's logical that for many cancers, just from a basic scientific perspective, that would be a preferred environment if you want to reduce the size of a tumor cell or just make it very difficult for it to survive. So
Yeah.
I think that's important.
You definitely make it more stressed, right?
Right,
It's like, whoa, I'm not going to survive, and
right.
that's why we think there's that differential response. So now we hit it with chemotherapy, or now we hit it with
Yeah,
radiation therapy, or now we hit it with hormonal therapy,
that's
and
right.
that cell, you don't, like, done.
That's
Yeah, so
right.
we hopefully are augmenting that oxidative stress to the cancer cells while our normal cells are happy.
That's right.
They've also slowed down their proliferation to some degree, so they're not getting hit as hard during that therapy as well. So
That's
that's
right.
what's been shown in some of those fasting or fasting mimicking type diets during and around chemotherapy is that those patients have less toxicity, maybe
That's
less
right.
nausea, less fatigue, less GI distress, less hospitalizations, less need for dose reductions.
That's right.
It just kind of optimizes. And I've had patients who've done it without keto and done it with keto and feel
That's
like,
right.
wow, it's like night and day
It's a big
difference.
difference. You
Yeah,
you really I'm gonna circle back to Martha Tintenborn. And I pulled up the book. It's called Hacking Chemo Using Ketogenic Diet, Therapeutic Fasting, and a Kick-Ass Attitude
nice.
to power through cancer. For those who want to learn more, check out her book. And also the podcast episode. If you just search her name, Martha Tintenborn and my name, you'll see that episode. And I think she's a nutrition professional, but she was able to share the potential that, and everything you just said is what she said. It's like they just get through it a lot easier. They don't feel as sick. Yeah, they may lose their hair, but they don't have that nausea and things like that. And it makes the chemo journey more effective and, more importantly, more tolerable. And as we know, many people fear chemo because of how it makes us feel. Let's circle back just a little bit to a person who comes to you, and you have some patients who are in a body that's higher than the BMI standard by a lot, and you have some people who are even below the BMI standard. The assumption is that you kind of touched on that, but a person who's a little thinner to start their journey, uh, is there a way for them to really do this without losing even too much weight? Because obviously you need to have some weight to lose in order to survive cancer.
Yeah, for sure. So we know that muscle mass is associated with cancer outcomes. So better
Yep.
muscle, better
Yep.
outcomes. So those really thin patients actually sometimes do equally poorly to some of
Hmm.
the obese patients. So what has been shown is that ketogenic diets are not necessarily weight loss diets.
Oh, I
They
learned that
are
myself.
weight balancing diets,
Nice
right?
term. I like that.
Yeah, so they really do help us augment our lean mass, put on healthy weight.
Mm.
And it may be those are the patients for sure that I wouldn't want to fast, right?
Hmm.
We want to get them in that ketogenic state, but optimize their nutrition. So we want to
Right.
get them adequate amino acids and micronutrients. We want to rebuild. So interestingly, ketogenic diets have been shown to stop and reverse cachexia. And I
Mm.
have a 90-year-old patient who was significantly cachexic, in that she had a very low albumin, very low total protein, very low BUN, low, just very malnourished,
Hmm.
and was, dealing with her stage 4 ovarian cancer and didn't want to do palliative chemotherapy. So we just tried to optimize her. And guess what? Her albumin normalized, her total protein improved. She stopped putting as much ascites into her belly. Her legs stopped weeping. And she was out in her garden feeling great. So she didn't lose weight, she gained lean mass.
Mm. And so you have this cachexia and you're literally just wasting away. And instead of focusing on the non-essential nutrient that's not as good at building things up, we need those essential amino acids and essential fatty acids. So it's logical that that would make more sense. It's just not logical for people who are thinking keto is just a weight loss diet, right? So I think
Right.
that's really important to distinguish. I've never had a weight problem, but since I've done keto and now carnivore, I've never had a muscle problem. Like, so I'm not
Right.
walking around
Yeah.
like Dr. Anthony Chafee or Dr.
Right.
I'm not going to do that. But
No.
what I do know is that whenever I touch my quad, it's a rock, and it's never really been that way. And ironically, I only exercise maybe twice a week. And when I skip 4 weeks because of, some reason, it seems like it doesn't go away. So it's pretty amazing. And even Dr. Anthony Chafee said this. He said that he goes a couple of weeks without exercising because he's a neurosurgical resident. So he'll get
Right.
busy, but he still maintains his muscle because his diet is built in such a way that it's going to feed that muscle everything it needs. So I think that's awesome. I like that that balancing, the weight balancing diet. I hadn't heard that term before,
Yeah.
but that's a great term. It makes a lot of sense. So in terms of I was a plant-based guy before I started low carb, 11 years ago. And it was always cancer was treated best with plants, right? And I think we understand having this conversation that that's not necessarily the best approach, although it can work for people. But people always come to me and say, I've been juicing. So just comment a little bit about
Yeah. Well,
that.
so back to metabolism, right? If somebody is taking away Oreos and pizza and pretzel, okay, maybe by replacing junk food with fruits and vegetables, they are doing themselves some degree of service initially
Yeah.
because they probably are reducing their glucose and insulin dysregulation. But unfortunately, they are not providing those essential amino acids and those
Mm-hmm.
essential fatty acids to the same degree. And eventually, we then start to see the micronutrient deficiencies and maybe the muscle wasting and such. So I
Mm-hmm.
always say that in the beginning, it may be okay, but it's not a long term solution.
Mm-hmm.
And every person is different. Some people, that amount of carbohydrate is still too much for them and it hasn't budged them at all. Maybe even made them worse because maybe they stopped eating meat and eggs and started eating more plants, more
Mm-hmm.
carbohydrates. They
Mm-hmm.
actually went in the opposite direction, which I have seen happen. The whole juicing thing, I'm an anti-smoothie, anti-juicing. I don't even care if you choose low carbohydrate vegetables and fruits because what has been shown is that when you disrupt the fiber bond in the carbohydrate in that plant, you actually increase the glucose and insulin
Mm-hmm.
response. And if you take that fiber completely out, so it's like smoothies and purees are 1 degree of increased glucose and insulin. And then juicing is a completely higher degree of glucose and insulin dysregulation. And it sometimes goes back to the old, what's called the Gerson therapy
Mm-hmm.
diet, which was
Yep.
plant, but it was actually liver and
Mm.
juicing. So they were eating liver to get their essential amino acids and their broad, strong micronutrient boost. So it wasn't all just juicing. And
Mm.
somehow with this whole anti-meat agenda, we've kind of dropped out all animal-based products and we're slowly, sadly, significantly increasing that carbohydrate intake. And I can't find any study that looks at only plants or
Mm-hmm.
that support it in cancer. And in fact, the randomized trials that have been done where they have encouraged or increased substantially plant intake has not shown any difference.
Mm-hmm. That's correct. Wow. It's again, I think I think the challenge we face is that a lot of the things we're talking about are so opposite of what other people may have heard that they're going to struggle, and they're like, I don't know who to trust. So I think that's a challenge we'll continue to face. That's why we'll try to always support what we do and share with some type of data. Like
Yeah.
you say, you're a data person, I'm a data person as well. And
And
I just, yeah.
yeah, and I'll make one other point is that if somebody is just telling you what to eat, and they're not looking at your metabolism. They're not
Hmm.
looking at, as we've just discussed, that glucose, insulin, and IGF-1 and LDH, and these are markers that we can look at and use to say that is what has been shown in studies to enhance or improve outcomes. So it really comes down to what is your metabolism doing.
Hmm.
So fine,
Okay.
eat whatever diet you want, but look under your hood. Is it moving those markers in the direction that we actually want them to move? And if they're not, that is not the right diet for you.
Cool. So so I have my purpose, which is besides I have to say, as my wife would kill me, make sure she's good. That's number one. But my goal is to help the world achieve metabolic health. That's why we're with the Society of Metabolic Health Practitioners, etc. So if I could, if I were to call you, if I were to put you if you were in a bottle and you're, I dream of Jeannie, I'm gonna say I dream of Dr. Christy. I would wish that for the world, right?
Thank you. Yes.
Yeah, but let's reverse that. Let's put me in a bottle, and if you could just rub it and say, "This is what I want the world to look like if I could make it happen." How would it look for you in the next 5, 10 years or so? What would you see? What would you like to see different?
What I would like to see is that the conventional oncology world look at metabolism and embrace metabolism. And I would say that not only for the oncology world, but the diabetes world. No
Mm-hmm.
diabetic should be eating 60 grams of carbohydrate in a meal. I don't even eat that in a week. Um, and we don't need it. And when I've had dietitians tell me, I'm like, I have not had carbohydrates in 22 years. Tell me how that's
Right.
hurting
How is
my
that possible?
brain, um, and I shouldn't say that strong because over the 22 years I've had my journey and I've done
That's
different
right.
things along the way. But in the last 10, I've been extremely strict because I've realized what those things were
That's
doing
right.
to me. And you could feel it, right?
Yeah.
You knew that things were different. So I truly wish that our conventional world would embrace this more readily. But
Mhm.
I just feel like it's a grassroots thing. So there have to
Mhm.
be enough of us out there educating the public. And
Mhm.
that's why I appreciate your podcast. That's why I
Mhm.
appreciate Dr. Westman and his podcast and everybody that's out there spreading the word. And I feel like the more of us that are out there, we're educating the patients. The patients
Mhm.
are often far more knowledgeable than the physicians that they're going to see.
Yeah.
And
Yeah.
and sadly, if we optimize our metabolism prior to our chronic diseases, we don't need our conventional doctors nearly as often. And that can be a problem for those who are, in that model. But I don't think anybody is telling people things, what I would consider the opposite of what they should be telling them because they're trying to make them sicker or
That's
keep
right.
them in the healthcare model, which I hear all the time. I really don't. I believe that everybody is in medicine because they wanted to help people and they think they are helping people
That's
and they
right.
think they are doing the right thing. But once you actually see the data and see the results and see the transformations in patients, you cannot unsee it and you will never go back to advocating for the opposite.
No doubt about it. Well said, and I'm going to do my best to make that wish come true. Use my magic. So as we wrap up, of course, I want you to reflect on your next 12 months, and we're always working on something personally. So when you think about the nest and rope, rather it's through nutrition, exercise, less stress, more sleep, how we think, recovering from trauma, or the rope, which gets us to the nest, the relationships, avoiding organisms and pollutants that harm us, and of course, protecting our emotions and making sure our life experience, like the experience of hanging out with you, 15
Yeah.
minutes away from my house, but
Yeah.
virtually.
Yeah.
What areas do you hope to focus on?
I will say that the nest has been my passion for years. So I always continue to work on those. Those are just non-negotiables for
Mm-hmm.
me.
Yeah.
I will say as my life is transitioning, as my children are growing, as I'm now an empty nester, and mine is really more probably about the life experiences where I have a little
Mhm.
bit more flexibility. I have more
Mhm.
flexibility in my work. I have more flexibility with my responsibilities at home that, I now have international family. My son lives in a different country. My sister lives in a different
Wow.
country. My brother lives in a different country. So I'm
Wow.
hoping to open up some of my travel
Mhm.
experiences and bonding more with my husband now that we are in a
Amen.
different stage in life.
That's right. It's definitely interesting. Me and my wife are doing the same, and it's been a rediscovery in a lot of ways. So I'm really enjoying that. Are you, we're gonna definitely share the link, for the Metabolic Nutrition for Cancer course. I think people who are really interested in understanding it and diving deeper, and is that course for lay folk and clinicians, both?
Yeah, I do. I think that our cancer patients are so savvy. They want the data. They want the information. So it is a 16 lesson series that goes over kind of why we get cancer,
Mhm.
who who has higher stages of cancer, how do we impact outcomes in cancer if
Mhm.
we're going to incorporate diet, how do we do that? How do we check it? How do we follow up? How do we know we're doing the
Mhm.
right thing? Um, to the level of the data that we have. I can't say that there's
That's
one
right.
exact right way. And then also, I really try to dig into some of that myth science. So, where did this plant base come? What is
Mhm.
the data that we have available to us? What do we have from fats and meats and smoothies and food processing and the whole shebang? So, and it is a completely referenced program.
Nice.
So every single study that is discussed is given to you with a link. There are many handouts. How do you actually get started? How do you
Mhm.
test and track? We're and with 3 live Zoom, meetings with me. So there's a lot of question and answer that will go along with it.
Cool.
So I really had it in mind that this could be for anybody, somebody
Okay.
who wanted to avoid cancer, somebody who wanted to optimize their current cancer therapy,
Mhm.
somebody who's had cancer and just wants to optimize their overall outcome, maybe stop it from coming back or getting another cancer, as well as physicians that really aren't aware of the data. So I've done all the work for
Mhm.
you. You just come and you can, you know, enjoy
Just
the ride.
just enjoy it, and and I'll say this, and I'm not gonna say this arrogantly, but if you're a clinician and you're not seeing the outcomes you had hoped to when you started your training and you became a doctor or advanced practice clinician or other, and you're looking for a way to add value to your patients' lives in a way that they have never seen, that is likely your colleagues are not adding, why not give yourself that opportunity? It's almost like when I recommend, when I talk to my patients about the Seven Principles of Marriage by Gottman, which is a great, kind of marriage book. It's research based. So if there's something out there that can literally change your relationship, and in this case, change how you practice medicine and or how you heal from cancer, you got to give it a look. So I really encourage people to really give yourself that opportunity because it is a game changer. And I cannot, as you've suggested earlier, go back to the old way of thinking while being skeptical.
Yeah.
I'm never going to be indoctrinated into carnivore or keto for cancer, any of that, because if you show me something that says something else is a better approach or at least an additional option for people, I'm all ears, even though you can't see my ears right now. So
100%. I'm right there with you.
that's right. So as we wrap up, are you on social media?
I'm really not. I do have an old Facebook page, but I haven't been there. I really am just focusing on this new practice.
Okay,
I'm interacting with folks in the metabolic health space. So,
that's
really,
right.
not social media. My website is kessrx.com,
Okay.
and you can always get a hold of me through there.
Okay, we'll
Um,
share that, and I'll also link the interview you did with Dr. Westman. That
oh,
way,
perfect.
because it's similar but different, so that way they can kind of hear you chop it up with Dr. Westman.
That would be awesome.
So thanks again for being here. Let me wrap up with a few thoughts and then we'll wrap this up, okay? So thank you so much.
You're welcome. Thank you.
All right, guys, today we had a great conversation with a wonderful doc not far from where I live, and I really enjoy getting to know her. This is how I get to know people. I don't have time to meet, so I just do podcasts, and I really enjoyed it. So I hope for those who live in the metabolic space, some of the information may only have confirmed what you already knew, but for some of you guys, it's eye-opening, and I hope that it removes fear about keto and using keto as a possible way to reduce your risk for cancer and or treat your cancer. So no matter how you perceive cancer, our goal is to simply provide a broader perspective, which hopefully will empower you with additional tools to help you deal with any medical condition, but in this case, cancer. So as we conclude, I thank you for spending some of your valuable time with us today. Make sure to comment on anything that you want to share with others who are also following this podcast. And until we meet again, continue to be safe, be well, and continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.